Hello, we are back again with Breeze, and we're going to be looking at the fire element points. Now, the fire element is unique, and then it does have 2 organ pairs associated with it, so 4 channels. So we're just going to cover the first 2, which is going to be heart and small intestine, and we'll cover the other 2 in a different video. So these spots are going to be marked in red, and the heart is the yin organ, and the small intestine is the yang organ. The first point we're going to talk about is going to be heart 1. And heart 1 is an amazing relaxation point. And it is way up in, it's going to be kind of hard to show, it's way up in the armpit. So if you get into the center of the armpit and you go way up deep, you can kind of see it. That is heart. It's very difficult to mark when you can't see what you're doing. Way up in that armpit is heart 1. And then heart 3 is you just shift a little bit forward in that same crease. So I should have marked here. She was standing kind of differently, so these have moved. This was in the armpit, and then heart 3 is up front. And heart 3 is going to be the water point on that channel. And then from heart 3, it actually comes around the front of the leg. And the next point we're going to go to is heart 7, and that is the source point. And if you make like U with your fingers and run down here, you will fall into, right at the top of this joint, you'll fall into a spot, and that is going to be heart 7. And then as you keep going down, the next point is going to be heart 9. And heart 9 is not only the ting point, it's the tonification point, and that's going to be a third of the way. You either call it a third of the way around from the back, 2/3 away from the front, or on the left foot, this is going to be 8 o'clock, and on the right foot, it would be at 4 o'clock, and those ting points are going to be about a finger's width up off the coronary band. That is heart 9. Next we go to small intestine 1, and that is going to be a third of the way from the front, 2/3 from the back, or at 10 o'clock on the left foot and at 2 o'clock on the right foot. From small intestine 1, you go up to small intestine 3, and the way you find that is that here's this tendon, here's the splint bone, and then here's the cannon bone. And if you run your hand down between that splint and that cannon bone, there's usually a little bump, and under that bump, you're gonna hit a divot, about a thumb-sized divot, and that is small intestine 3. Now that is a point that is helpful with back and immune system, and it also has to do with the governing vessel. So back, think back and the immune system. And then the next small intestine point that we come to is small intestine 9. And small intestine 9 is great for shoulder issues, as it is a local shoulder point. And if I could use 2 hands, you would see that it's midway between on this shoulder, in the muscle, in a dip, and you can usually see that dip from pretty far up. And yeah, if I could use 2 hands, you would see. And then the next point is going to be small intestine 16, which is it is a test point, and test points are used to test the health of, it might be a joint, or it could be sometimes it's an organ system or a channel. So this one is the test point for the tendons, very important. And the way that is found is, we're going to go to the non-main side, only because this is very difficult to do with that much hair. So it is between C2 and C3. So you have C1, and then C2 kind of curves down, and because their neck actually goes like this and then curves back in, and it goes lower. It's not up here, it's down here. Their cervical vertebrae. So you have C1 And then C2, and C2 is big and it curves. And it's right between C2 and C3, off the midline. Thank you, Cisco. That's what I needed. And you'll feel it. And small intestine 16.